Hi, Early Start family, early childhood educators, leaders, and community in general. Welcome to our third Early Head Start Rising Summer Webinar 2023. I'm Sully Vasquez, the manager of Early Head Start Professional Learning Programs at NHSA. We kicked off the Early Head Start Summer Series in June with the Multilingual Babies webinars in English and Spanish presented by Dr. Stachak and Tanya from Unidos US. If you attended the Early Head Start Learning Series webinar before, welcome back. If you missed one of our both of our previous live sessions, the recording is available for you on our website. For those of you who are joining us for the first time, I'm very excited you're here. Thank you for being with us today. Please share in the chat your name and where you're zooming in from. Before I introduce our guest today, I want to remind you that these Early Head Start Summer Series are part of our Early Head Start Rising campaign. If you would like to know more about the Early Head Start campaign, please visit our website. You will have the link in the chat. Feel free to check it out. Our webinar today is Effective State Level Policies to Strengthen the Early Years. It's my honor to introduce our presenter today, Dr. Cynthia Osborne. Dr. Osborne is a professor of early childhood education and policy in the Department of Leadership, Policy, and Organizations at the Peabody College of Education and Human Development at Vanderbilt University. She's also the founder and executive director of the National Prenatal to 3 Policy Impact Center. Thank you, Dr. Osborne, for taking time out of your busy schedule today to present for us. Before I pass it to Dr. Osborne, I want to remind the attendees that if you have questions, please put them in the chat. We will have some time towards the end to answer as many questions as we can. So, Dr. Osborne, welcome again. We're happy to have you.
Well, thank you so much. I'm so glad to be able to be a part of this great meeting. So many faces that you get to see popping in, and I'm hoping that we can have a conversation and that you use the chat kind of actively and ask questions. It's sometimes hard for me when I'm presenting slides to see the chat in real time. So I was saying to Julie earlier, if there's any sorts of points of clarification and so forth that you need to have answered while I have my slides up, please just take yourself off mute and ask me. But I will definitely save time at the end for us to be able to engage in conversation and learn from you. So again, thanks so much for the opportunity to join you today. I am going to share some slides to talk with you about the work that we have done to really identify what the most effective state level policies are that can be implemented to really ensure that all children thrive from the start. I have the privilege of directing the Prenatal to 3 Policy Impact Center that's now at Vanderbilt, and our whole purpose is to be a resource for states as they really think through how to create a system of support and care for children and families from the earliest ages. So before I begin, I wanted to just share with you really what it is that kind of shapes our thinking and the basis for the work that we do. And really, all of our work is built upon the science of the developing child that has become increasingly clear about how important the earliest years are for children's healthy development. We know that the first 3 years of life are the most rapid and sensitive periods of development, and that when we can expose children to safe, stable, nurturing environments in these earliest years, that really sets them on a trajectory for lifelong health and well-being. And conversely, when children are exposed to adversity, especially chronic adversity, that in the absence of a loving, caring, stable adult, that can have serious consequences for the developing brain and body. And those consequences also can last a lifetime. And so we want to make sure that every child is able to have these experiences early on that really shape their lives. And unfortunately, there are millions of children across the country, particularly children of color and children with lower levels of income, that are not able to have these sorts of environments that we know are so important for healthy development. And we wanted to step in and say, well, how is it that we really create those environments? So what we did, I'm an academic, we rely on evidence and research, and we turned to what the evidence actually tells us will help us to create those conditions in which children thrive. And we reviewed thousands and thousands of articles and hundreds of the most rigorous studies that have been conducted to really identify what it is that can help children and their parents to create those enriching environments so that children thrive. And I wanted to share with you kind of the four main takeaways that we have from this review of dozens of state level policies. And the most important thing is that we found that there are policies that actually work, that will empower parents, support children's healthy development, and that we can make a difference. I know that might sound obvious, but the truth is that we hadn't, as a field, really done this kind of comprehensive look at what it is that will work. And there's a lot of things that we're doing that are probably really important, but they don't have the evidence to back them up. And so we wanted to see what do we actually know? But the evidence is overwhelmingly clear that there's nothing that we can do that only focuses on the child, that we have to think of the family. We have to think of the caregivers, not only the parents, but also those who are the child care educators or the early Head Start teachers and so forth. We have to care for the caregivers so that they can do the job of caring for the children that they're so in the best position to do. We also learned that there's just not a magic bullet. There is not one policy or program that we can implement and expect that things are going to be okay. That it really does require this combination of broad-based economic and family supports, as well as targeted interventions to create this system of support and care for our littlest ones and their parents. And we not only identified what the most effective policies and programs are, but we've been tracking and understanding what states are currently doing with regard to implementing these. And the patchwork of benefits and services that are available to families across this country is really stark and somewhat overwhelming. And so that where a child lives, the policy choices of the state in which that child is born and lives is really one of the single greatest predictors of the resources that that child and their family has available to care for that child. So I want to go into a little bit more details on these and share with you, again, what we've learned. And I also invite you to look at the resources that we've been creating and have made available to you online, that we currently have a roadmap that I'll share with you. And we're in the process of updating that, and we'll release the new, the fourth roadmap in October of this year, October 12th, and invite you to join that. My colleagues, both Maria and Eileen, are joining us today, and they'll be putting information in the chat on how you could sign up. But let me go into a little bit more detail. So I said that all of our work is based on the science of the developing child that tells us what the conditions really are that children need in order to thrive from the start for this lifelong trajectory of health and well-being. And so we operationalize that research into these 8 prenatal to 3 policy goals, that if we can create these conditions, we know that our children can reach their optimal potential. So we want to make sure that families have access to the services and benefits that they're eligible for. We want to ensure that parents and caregivers have the ability to both work and care for their children and families. that their households have sufficient and stable resources, not only income, but also housing stability and food security, that our babies are born healthy to healthy parents, and that we take into consideration both the physical as well as the mental health of the parents and the children. And that parents have the knowledge and skills and time and understanding of their children's development so that they can engage in those nurturing relationships that we know are really the key to healthy development. And likewise, that when our children are not with their parents, that they're also in these nurturing environments so that there's a focus there on the nurturing relationship between the caregiver and the child. And importantly, we want to identify any sort of delay that a child might be experiencing that would get them off track toward healthy development and intervene in a way that will help them to resolve those issues and get them back on track so that they can reach their optimal potential. So again, these are the conditions that we want, and science tells us these are what children need to thrive. And what our job was to say, well, then what are the effective policies that help to create those conditions? And I'm going to share with you that. Before I do, though, I just wanted to give you an overview of how our children across the country are doing with regard to these 8 goals that we laid out. For each of the goals, we have identified a handful of measures, of outcome measures, that just give us a hint as to how our children are doing. And we have this information for each state in great detail so that states can understand where they may need to focus some of their efforts, and then therefore the policies that they may want to advocate for in order to help to meet some of these needs. But what you can see, there's a lot of information here, and we'll make sure that you have these slides so that you can process it, and on the website, like I said, there's a lot more information. But what we can see is just there's such huge variation between the state in which our families or children are doing, quote unquote, the worst, and the state in which they're faring the best. Where if you take something like health insurance, nearly half of all women who have lower levels of income of childbearing age lack health insurance in the quote unquote worst state, which is Texas, whereas fewer than 4% of those similar women lack health insurance in the District of Columbia, which has much higher income thresholds for Medicaid eligibility. And I'll go through that in a little bit more detail in the future, but you can see just that huge variation. But the variation isn't really all of the story, because there are some of these outcome measures in which, although the variation across states are great, no state is doing really the level of success, meeting the level of success that we'd like them to. So for instance, if we looked at the percentage of children who are under age 3 who are not receiving the developmental screenings that we know are there to help us to understand if they're experiencing delays or any other sorts of needs that they would have that we could address early on. In the quote unquote worst state, nearly 3 out of 4 children under the age of 3 are not getting their developmental screen. But even in the best state, 2 out of 5 are not. So over 40% of children there. So there's room for improvement in many ways. And again, we do this for each of the goals so that states can really see where they fall to the left or fall to the right, areas where they're doing well or areas where they could improve. And like I said, we didn't want to just stop by saying, well, how are our kids doing? We wanted to identify policies and programs that will ensure that our children can do better, that we can have it so that all of our children are reaching their full potential. So we created a prenatal to 3 state policy roadmap as a guide for states on what the most effective policies and strategies are that ensure that our children thrive from the start. And again, I welcome you to look at the current roadmap that we have. And we are in very busy mode of collecting information on all of now 12 effective policies and strategies from every state plus DC, so that we will be updating this for you in our October release. But I'm going to go through kind of a summary of each of the effective policies and strategies so that you can see what they are, but to go into greater detail on several. The important thing here is that it is a combination of broad-based economic and family supports and targeted interventions. It's not just programs and it's not just policies. It's not some of the usual suspects. It's also things like economic supports and so forth. And in our roadmap, we not only have an overview of kind of how the US is doing, we also provide a detailed summary for each state, so they have their own roadmap, as well as a deeper dive on each of the effective policies and strategies, so that we have hundreds and hundreds of data points for you to be able to use to understand the policy or program that you're most interested in. So again, we started with the science of the developing child that told us what the conditions are that children need, and we identified what the most effective policies and strategies are that states can implement to create these conditions. And this framework, we call it the grid, really shows the alignment between those 8 policy goals up at the top and the 5 policies and 6 strategies that we've identified. So the policies include making sure that families have access to health insurance, and by expanding Medicaid is the most effective way of doing that. And you can see that each of these policies has an impact on at least one of the goals. There's no policy that impacts every one of the goals, and which is why, again, you're going to need this combination of policies and programs to really fulfill all of these goals. But so expanding Medicaid, making it so that we reduce the administrative burden for families to be able to access any of the programs that they are eligible for. We focus on SNAP because that's the most robust nutrition program that we have in the country. But these ideas of how to reduce administrative burden really apply to many of our policies and programs, making it easier for those who are eligible to access the benefits that they are eligible for. A paid family leave program that's a minimum of 6 weeks. The states that are implementing them now are looking at 12 weeks. The research, however, is focused only on the 6-week program in California. And so we're looking to expand that evidence base and learn how longer leave programs have even a bigger impact. A state minimum wage that's at least $10 an hour also is a really important asset for not only increasing resources in the household, but it's also associated with better birth outcomes, and a refundable state earned income tax credit that's at least 10% of the federal credit. And none of these are we saying, what we line up here is the threshold, the minimum threshold that a state needs to meet in order to actually see the benefits that the evidence tells us is possible. But again, we encourage states to be as generous as they can to better improve the outcomes for families. So in addition to those policies, we also identified these strategies. And strategies have all been, when they're on the roadmap, they've all been shown in rigorous research to be effective. However, the research is less clear exactly how states should implement these. Whereas the research is clear that a minimum wage has to be at least $10 an hour. When it comes to something like Early Head Start, that's a federal to local program for the most part. And so how a state should intervene or be an Early Head Start provider, rather if it's through a partnership or launching their own program and so forth, that is really kind of up in the air. And then we're still trying to learn about the best way to do that. But the 6 effective strategies that were in the roadmap include what we call comprehensive screening and connection programs. These are things that you might have heard of, like Family Connects or Healthy Steps, in which everyone is offered this program. It's voluntary, and it's somewhat low touch, but the idea is that they conduct a screen and they connect the family to the services that that family needs, not just what we have, but to really make sure that we're aligning the need of the family with the services that they receive. Also, we know that childcare subsidies are just a crucial policy to help both support the overall economy, but also parents' ability to work and care for their child. Group prenatal care, which is exactly like it sounds, in which moms or birthing people about the same level gestation meet in groups up to 8. Their individual health care is provided privately, but they're able to meet jointly to be able to understand and get support for that transition to becoming a parent. Also, our evidence-based home visiting programs, the most robust evidence is focused on parenting. Our early Head Start, which is aligned, as you know, with many positive outcomes for children and their parents, as well as our early intervention or Part C services that we know are also so important for getting kids to meet their full potential. So these are the policies and strategies that the research says are effective. I'm not suggesting that other things don't work at all. It's just that the research to date hasn't been as strong as it has for these. And that some things haven't been studied at all. Some have been studied and the findings to date are null. But we are following that evidence base. In fact, this is a little teaser for more to come in October. Because of new evidence that's come out, we've been able to add community-based doulas to our effective strategies, and they'll be added to the roadmap. So we're really excited. You know, the goal is to keep adding new things as the evidence grows. But across the country, the number of states that are implementing these effective policies and strategies just varies completely. This is just a policy count by state. And to date, there are 6 states that have implemented all 5 of the effective policies. The truth is both Rhode Island and Oregon will be added to the list this year because they have now implemented their, or Oregon will in September, Rhode Island has, but their paid family leave programs. But there are also 6 states that have not implemented any of these effective policies. North Carolina will move out of that list because they've expanded Medicaid, but still too many stay in offering very few of these benefits for families. In the roadmap that's online, we also provide in-depth information and kind of summarize where states are on each of these policies and strategies. And what you can see, if you look in that kind of where the circle is with 39 and 33 and so forth, that the number of states that have implemented each of the policies varies somewhat, quite considerably. So we're up to now 41 states, including DC, that have expanded Medicaid. So both North Dakota and North Carolina are added to the list of states this year. But only 7 states so far, plus Rhode Island and Oregon, that have implemented a paid family leave program. So what type of policies and how generous they are varies so much across states. All right, I'm going to move forward a little bit to really tell you more about the types of resources that are available in the roadmap for you. Not everyone is as interested in each of these policies and strategies as I might be. Some of you may have some of your favorites, but I'm going to offer some of the highlights. And also, in case you are interested or want to share this, that you'll understand the type of information that we provide. So for each of the policies and strategies, we begin by providing just a broad overview of who it is that has adopted this and kind of the level of activity that we've seen around that policy or strategy in the past year. Again, all of this, this is all based from October 2022. So just in a few months, we'll everything is going to be updated, and we'll have our new annual roadmap out. But this is somewhat unique, and if any of you on the call who are advocates may find this information helpful. For each of the policies and strategies, we provide what we internally call our impact tables, where we pull right from the literature, right from the most rigorous evidence, to provide you with some proof points as to what the potential of the impact of this policy can be, and which goals each of the policies can have an impact on. And so with Medicaid expansion, we see that not only does it increase the access to having actual health care, it also increases a family's financial resources. It's one of the most effective policies that we have on reducing inequalities in birth outcomes. And it's linked to children's health and well. This is adult Medicaid linked to children's health and well-being, particularly with regard to child welfare. And so these provide you with some of that specific information for each policy and strategy we do that. We also provide you with as much information as possible on the generosity of the program across states, so that you can really see how your state compares to others and what the range of possibilities are, or range is. This is for Medicaid income eligibility. In states that have not expanded Medicaid, there are no childless adults in those states that are eligible for Medicaid. For parents, however, if they expand Medicaid, the federal limit is that at 138% of the federal poverty level, families with incomes up to that level would be eligible for Medicaid. Above that, they would have to buy on the marketplace. There are a few states, Connecticut and DC, in which they have actually extended that income eligibility and are higher than the federal limit, such that in DC, it's 221% of the federal poverty level, and a parent is eligible for Medicaid. Well, in the gray, you can see the states that have not expanded Medicaid. And that if you see a state like Texas, in which the federal poverty level in a family's income has to be below 17% of the federal poverty level. That is, if you have a child, if you're making more than $300 a month, you are not eligible for Medicaid in Texas. Alabama is almost as low. So you can see why the relationship is so strong between states expanding Medicaid and the percentage of lower income women of childbearing age who lack health insurance. So this just shows you kind of the reach of programs, the impacts that it has on who has access to services. And again, I mentioned DC versus Texas earlier on, but you can see where your state is and how that compares to other states around you. So for something like a paid family leave program, one of the things that I think that I've learned about paid family leave that's so interesting is every state calls it the same thing, a paid and family medical leave program, typically. But every state's program is so different. Currently, like I said, as of October of last year, it was only 7 states that had fully implemented the program. In January, Rhode Island did. In September, Oregon will. And this year, Minnesota and Maine both have actually passed paid family leave programs. So we're up to 14 states now that actually will, have enacted a program that will be implemented in the next several years. And the paid family leave programs are the policy that has kind of the largest impact on the most goals. It's not only about making it so that more folks can take leave. They're more likely to attend their postpartum visits. They're more likely to work and return to their part of job that it increases resources in the household substantially. It increases maternal mental health. It improves the interaction that families have with their children, the time that moms spend with their children. And it leads to better health and well-being outcomes for children writ large. So there's not a policy really out there with stronger evidence that it makes a huge difference. But the way that our programs are developed hasn't been studied enough for us to understand kind of what are the elements that are the most important. What's the best way of designing a paid family leave program? So if you look at the number of weeks that are available, it's now 6, it was 5, but 6 to 12 weeks. If you look at the percentage of wages that are reimbursed, it's 60% to 85%. The maximum benefit has a huge range, whether it's paid for by the workers, by both the workers and the employers, or only the employers, who's eligible, who's excluded. All of these things differ widely across states, which actually has a big impact on the level of benefits that families have available to them when they want to use this benefit. So you can see that the number of weeks that a family, is offered certainly has a big impact on the overall benefits. But the generosity of the wage replacement, the maximum benefit varies so much. There's also a lot of variation in whether the policy is good for lower income workers as it is for more middle income workers and so forth. But I can answer more questions about that, but it's really important when we're thinking about paid family leave to think about many of the mechanisms at play. A state minimum wage policy, to date, 25 states have a minimum wage that's at least $10 or greater. And nearly, I think it's 10 states will have a minimum wage that's at least $15 by the next 3 years. And more states this year will kind of pass that $10 threshold. And there's often pushback on a minimum wage. Some people think it doesn't really apply to many families anymore. But the truth is there are a lot of parents with young children who are working at jobs that are very near the minimum wage, if not at the minimum wage. And that when you see an increase in minimum wage, that really has an impact on not just increasing the wages and overall income in a household. It also has a really important impact on birth outcomes as well as on children's well-being, whether it is on reducing incidences of neglect or also kind of more likely to be healthy, show up to school, and other sorts of important indicators. But you can see this range. There are a number of states that still have the federal minimum wage of $7.25 an hour as their minimum wage. And then, like I mentioned, there are a number of states that are moving up closer to a living wage within their state. Yes, if we adjusted for cost of living, some of this would change, but not as much as you think it would. And so, the minimum wage really is just part of an important system of care. In addition, we've been looking at tax credits. The most common tax credit at the state level is an earned income tax credit. And as you are mostly, I'm sure, all aware, that the federal child tax credit that was paid out monthly and expanded substantially for a short period of time during the pandemic, that had a huge, huge impact on the well-being of children and families, reducing poverty, reducing food insecurity, reducing housing instability, and so forth. Well, more and more states now are looking to adopt something similar to that, and we'll be having an update on that sort of information. But most of the research has been on an earned income tax credit. And not only is it one of the most pro-work policies that we have, it also improves household resources. And it's one of the few policies that we have that leads to reductions in disparities in birth outcomes between women of color and white women. And across the states, there are lots of different types of earned income tax credits, from the level of the benefit to who has it, whether they have anything, whether they even have an income tax. Washington was the first state, the only state without a state income tax, to actually adopt a credit that's very similar to earned income tax credit. But of the states that have one, you can see the range is just huge, from a 3% refundable in Montana to 70% in DC. So if you hear that a state has an EITC, ask how much. It varies quite a bit. For the strategies, just in the interest of time, I'm not going to go through many of the details here, but obviously there is more information that we'll share with you, and lots on the website. But the story is typically the same for all of them. Basically, every state is usually doing something, but the variation across what is happening in states in terms of how many folks who are eligible are being served, the generosity and the benefits and so forth, that varies quite considerably. So that was for group prenatal care. This is the percentage of eligible kids receiving evidence-based home visiting programs. And you could just see the wide variation across states. Something that is obviously near and dear to so many of you is the important policy of early Head Start, and just the robust research that shows us that it not only helps with health and well-being and interactions, but really improves children's cognitive and social and development. But the percentage of kids who are eligible for early Head Start who are actually receiving the services varies so much, where it's nearly a third of kids in DC to fewer than 5%, in places like Tennessee, where I live, Texas, where I just was for the past 17 years, and Nevada and so forth. So, and this varies not only from the local sites being willing to administer the program, but also from the state's investments and how states are investing. And in our roadmap in the profile, we go great detail about how states are investing. Okay, I'm going to spend just a minute on child care subsidies because it's hard not to hear just how important childcare has been to families and our economy. Families cannot work if they don't have childcare. The economies suffer. This has been a real struggle. And the evidence is clear that they make a really important contribution to allowing families to work and improving their resources. But right now, we know that providers are not paid enough, our educators earn way too little, and our families just can't afford to pay one more cent. We have done studies now in both Texas and New Mexico and Virginia to really better understand what the child care systems are looking like and where the problems are stemming from. We've also tracked all states in DC in terms of all of the changes that they've made with regard to increasing subsidies, supporting teachers, and so forth. So we have a real important landscape kind of analysis of what's going on out there. And I think one of the most striking findings that out of our work in Texas, where we were able to determine the level of wages that teachers are paid, childcare teachers are paid, based on their years of experience and education and training. And what we found on the very bottom is that an early childhood educator with really no experience and only a high school diploma, their average wage is about $12 an hour. And a lead teacher with a bachelor's degree and many years of experience, their average wage is just over $14 an hour. So that difference of just over $2 an hour for that advanced degree and years of experience really illustrates that there's just not a career pathway for many of our early educators. And that's just not fair when you think about it compared to what a living wage looks like or what our public school teachers are paid, who obviously are not even paid well, as much as I would think that they deserve as well. Our child care subsidy programs vary so much when it comes to who's eligible, how much you can make in order to be eligible. New Mexico is at 140% of the state median income, whereas Indiana, Iowa, Ohio, New Jersey, and so forth are more at 40%. So, our eligibility varies so much. And then how much our providers get paid and how much families are charged varies considerably. This graph is way too busy and has too much on it, but it's really my favorite graphic. And it's because it shows that variability across states in a way that I think few other things can. That length of that bar is the market rate at the 75th percentile in a state, meaning this is what 75% or kind of what providers are charging families at the 75th percentile. If you line them all up, this is where the 75th percentile hits. And that's what the federal government calls the equal access target. And you break that up, that first blue is the state's contribution to their reimbursement rate. And the navy blue is the family's copay that would be required for a family who's making about 150% of the federal poverty level of what they would have to pay. And those together make up the state's base reimbursement rate. And that teal color is the amount that basically the reimbursement rate doesn't cover that the family may have to if they wanted to access the quality of care at that 75th percentile. So this just shows you how wide of differences there are. And what we wanted to do is to pull together all of the policies that I've talked about, including our child care subsidies, and show how they intersect to provide resources to families or not. So we created a stylized family so we could compare across all states. And this is a single mom who has an infant and a toddler. She's working full-time at a state's minimum wage job. And she leaves her children in childcare in order to work. And that childcare charges the 75th percentile of the market rate. It charges that equal access target number. And let's just take three states that are very close together, DC, Maryland, Virginia. And you can see just from wages alone that there's quite a discrepancy in the level of resources that this mom would have to provide for her children. In DC, she'd be making nearly over $33,000 a year. In Virginia, still quite a lot more than what the federal minimum wage would be, but still less than $25,000. But then she has to go to work, so we have to take into consideration out-of-pocket childcare expenses. And all of these states have done a pretty good job at minimizing the level of copay that would be required. There are some states in which that red bar goes way back. But it starts to eat into the level of resources that that parent has, and to make things, you can see the differences between states changes as well. And then if we added in the nutrition benefits that she's eligible for, as well as the state and federal tax credits, then you get a better sense of the true level of resources on an annual basis that this mom would have to provide for her child and the variation that's there. And these are three of the most generous states. Again, this is too much for you to try to take in for any particular state, but it's just there to illustrate that that same mom, when she is in DC, has nearly $47,000 a year to provide for her child than if she lived in Georgia, in which she would have just over $22,000 a year. Again, if we adjust for cost of living, the ordering and the magnitude do not change as much as you might want it to. But not only is this just a level of resources, again, too much information to try to take in on the slide, but what this is showing is that that same mom in DC also had paid family leave, 12 weeks of it, when her infant was born. And she has access to Medicaid, even at that threshold. Whereas in Georgia, she does not have access to Medicaid and no paid family leave. So again, just the range across the country in the level of resources and benefits that families have available to them. All right, I spoke for longer than I should. I could talk about this forever, but I am really excited to be able to share with you some of the resources that we've created and invite you to explore them more and to provide us with feedback on information that could be even more helpful to you. But it is so important that we are trying to push more for the policies that we know will make a difference in our kids' lives from the start. So I welcome your questions, and again, apologize for talking longer than I should have.
Oh, no, please. That was wonderful. Thank you, Dr. Osborne, for sharing an overview of how the states and their policies support prenatal to 3 services and what they are doing to improve the system and the outcomes, and also for all the resources you share with us today in the chat. All right, folks, the floor is open for questions, or if you have any comments, please unmute yourself. I do not see any questions in the chat.
I know it's so much information to take in. I apologize for the flood, but really, it's. I'm always curious if people, especially in groups in which there's lots of different states represented, if there's any kind of surprises that you saw related to your state, or questions that you have specific or information that you could share where we might be getting it wrong even, or things that we should be thinking about. I always appreciate that sort of feedback as well.
Anyone wants to share? We have a quiet audience today.
Oh, can you hear me?
Yes.
So thank you so much, first off, for being here today. This was very informative and generous in information. I just have a quick question. So, us seeing the differences of where families are in different states, we know that there's different rates as far as what they're going to pay, but I just wonder if the numbers look different due to the standards of living, right? So of course we know that in DC people will get paid more, but the cost of living is higher than in Georgia. So even though that parent looks like on paper that they have more resources, they're paying more to live. So do you see what I'm?
Absolutely. And in the roadmap, I was going to see if maybe I can even pull this up for you pretty quickly. But in the roadmap, we go through that to illustrate that the cost of living doesn't explain it enough. So let me see if I can just share with you that really quickly, if I can just share my screen. So certainly it is true that it's more expensive to live in DC than it is in Kentucky, since you can hopefully see that on my screen here. But if you adjust it for cost of living, you can see that although the level of resources goes down a little bit in DC and Hawaii, and it gets a little bit larger in places like New Mexico or Arkansas, it's not making the biggest difference that you would expect. So still our families in Georgia, if you adjust for cost of living, are at 24,000 now, and that it relative to DC at 41,000. So It's a really important point, but it's not the whole story.
Got you. Okay, thank you. Thank you for that clarity.
Absolutely. No, I appreciate the question. Thank you. The federal funding issue, Dr. Mohammed, I couldn't agree more that states are, we're at this really important juncture where states are going to be losing a lot of the federal money that they are currently getting, as you're aware, and for many different things, from early Head Start to childcare subsidies and so forth. And if we don't make an investment, we're going to see just a really, sharp decline in the level of resources that are provided. I think states need to step in and find permanent funding sources. So New Mexico, for instance, allocated part of its land grant. Vermont just increased a tax on itself for early childhood. Louisiana taps into its sports betting revenues for early childhood. So we do see state efforts, but we need federal investment. It takes a lot of money. This isn't cheap, but it's the best investment, the best way we could ever spend our money. And Zuli, I think that you wanted to make a point about this important initiative that you guys are trying to push. So I'll stop talking there. But
Yes, thank you so much, Dr. Osborne. And yes, speaking of federal funding, so now I want to take a minute to invite you to raise your voice and take action, especially in this critical time, where the House Committee has released a bill that includes a significant and alarming reduction in Head Start and early Head Start funding. This budget cut could keep roughly 80,000 children and families from receiving Head Start, early Head Start services. So please take a moment to scan the code on your screen and share it with everyone you can. It will navigate you to send an email to your representative, letting them know you oppose this cut to Head Start, early Head Start funding. You can submit this every 24 hours. I do it all the time. This will only take a few minutes. Your voice really can help us continue our mission of serving every child. So if there's no other questions, I want to thank all of our attendees for being part of this webinar. As usual, I would like to invite you to take action with the information you received today and share the information with your staff, colleagues, and families. I believe knowledge is power when it's implemented and shared. So please help us bring awareness about all these great topics related to early Head Start. I want to thank all the members for supporting our mission. If you would like to be an NHSA member, please visit our website. The link is also in the chat. Next Wednesday, we have our fourth webinar with Emily Vincent, a bilingual speech pathologist who will be talking about speech and language developmental milestones from a bilingual, multilingual perspective. I hope you can join us. For those attending live, you will get an email with your certificate valid for 1 PD hour and another email with a recording of this webinar. All right, Early Head Start family, this is all for today. Thank you again, Dr. Osborne. It was such a pleasure to have you. Thank you for the great information. All right, people.
thank you.
Please be safe. Let's keep rising together. See you next time.
Bye.